What if communication made all the difference? And what if a split second could save a child's life? This is Triaj, a revolutionary mobile network designed to assist in the treatment of injured children. It's a pediatric patient database that allows you to create detailed and in-depth profiles that follow patients from injury to discharge. But Triaj is so much more. It's an advanced clinical decision support system that reduces uncertainty in the treatment of pediatric patients by using real-time guidelines created from evidence-based best practices. Triaj suggests sequences of care and can help you track procedural steps along the way. Its simple functions and intuitive design integrate seamlessly and help you monitor progress during medical procedures, all through the Triaj network. It deliberately links the phases of medical care and can be customized with the help of our advisory board with decades of practical experience. Triaj will help you avoid medical errors while improving the quality of patient care, all from your mobile device. Communicate timely information while enhancing collaboration for the healthcare team, from first responders to nurses and physicians. Triaj. Save children's lives with just-in-time care.
Hello everyone, Gareth Presch, founder of the World Health Innovation Summit, and absolutely delighted to welcome you to our session this evening. It's a webinar, it's a special webinar covering children's trauma in Ukraine and Afghanistan and other areas around the world. We're all familiar with the trauma that's being caused at the moment, and I'm delighted to welcome Dr. Eichelberger from the US. You're very welcome to the platform. We've just had a hard-hitting video shown before we started. Can you please give us a bit of background about yourself and how you're trying to help these children and also medical physicians around the world?
Well, thank you so much, Gareth. It's really a pleasure to be here, and good morning, good afternoon, and good evening to all of you that are out there watching, and appreciate you taking your time to listen to our conversation. I'm a pediatric surgeon. I've been so for 40 years, and I work at the Children's National Medical Center in Washington, D.C. I spent 3 years in the Navy, and so consequently I have a military background as well. As a consequence of my experience with pediatric surgery, I've become an expert in trauma care, burns, injuries in kids, and created Safe Kids Worldwide, which is a nonprofit that really focuses on prevention of injuries to children worldwide. The issue today is consistent with much of the thinking that we've done over the last 10 to 15 years. With the migration of children and mothers all over the world now, specifically we see it every night with the families, unfortunately, that are being displaced in Ukraine, into Poland and other places in that part of Europe. But this is happening all over in Asia as well as Africa, and some migration even here in the US in our southern border. One of the things that stands out all the time is the fact that these families now are at risk for injury. And the leading cause of death, that you may not know, but the leading cause of death between 1 and 14 years of age are preventable injuries, which means there's something we can do about that if it's preventable. Unfortunately, a lot of these children, even though we do everything we can to prevent those injuries, they end up having the injuries which we have to treat. Over the years, it's very clear that if we can prevent the injuries, the patients obviously do better. But one of the things that has occurred is that with the number of wars that have gone on and the conflicts all over the world, there's several things that happen. One is that these children of all ages are exposed to munitions, artillery shells, missiles, stepping on landmines, which is new because right now, most of us are in cloistered environments in hospitals. But when these kinds of injuries occur, there's not too many people who know all the problems that are going to go on with it. And so what we've done with Triaj Inc., which is a company that I've created about 4 or 5 years ago to focus on preventing treatment of injuries so that we do it in a quality environment that's safe, making sure that we coordinate our team so that people are having the information right at the bedside at the point of care. That point of care could be out in the field. It could be in a mountain someplace. It could be in a children's hospital, but most kids are not treated in children's hospitals. So one of the problems that we started to realize, and this happened when we were in the Afghan war. About 10 years ago, a surgeon, a very competent surgeon, called me from Afghanistan, who was the trauma center director, and said, Ike, I got a real problem on my hands. I got a 6, 8, and a 10-year-old who stepped on a landmine. They're hurt very badly, and I'm not sure what to do with them. He says, they're alive, but I'm not sure how to take care of them. Would you help me? Well, when he asked me that question, would you help me? I'm thinking 7,000 miles away. We've got 3 really badly hurt kids, and he's a general surgeon. He's not used to taking care of kids. So I said, we'll help you. And I spent 6, 8 weeks with him on the phone all the time trying to figure out how to take care of these kids. But what it pointed out was that there's a gap in knowledge that all doctors have when they're standing by the bedside trying to take care of the patient. And that's not just for the doctors, it's for the nurses, it's the corpsmen, it's the medics. So all of a sudden now it's very clear why the 3rd leading cause of death in the United States are medical errors. It's because there's so much information available now. Every 2 years, the amount of medical knowledge doubles. So that means that there's no one human being can keep all that information in their head. The other part of this is that when you need it, the one thing you're carrying is this. Everybody carries this all over the world. So this has become an ectopic brain. It's what you can use to help you take care of the patient. It's not to displace you. It's called a clinical decision support system. And the beauty of it is that it provides you guidelines so that if the child does step on a landmine and has a femur fracture, and he's 3 years old, and he weighs 16 kilos, you plug in those 3 pieces of information, his age, his weight, and the injury, this will auto-populate their care from the time you see them for the entire time through their discharge. It includes resuscitation, the surgical part of it, critical care, and aftercare. So it goes across the continuum of care. All the apps and the way we think now, we've got so many specialists that everybody forgets about the patient going through the whole process. You got somebody in each of these areas that knows everything about those areas, but they don't communicate it to the guy next down the line that's going to take care of the patient. Consequently, an error occurs. The patient either dies or worse, becomes disabled for the rest of their lives. So what we tried to do over this past years was to solve that surgeon's problem who was over in Afghanistan. And some people keep saying, well, this doesn't happen in our hospital. I guarantee you it happens in your hospital. I'm working in one of the best hospitals in the world, and we work every single day to try to prevent medical errors, and they still happen. It's a difficult problem because what's happened now in medicine, it's so complex that people don't talk to each other. And I'm talking about nurses, doctors, corpsmen, and medics, and any healthcare provider. So we tried to put together a solution to that problem. And I can tell you, it's taken us almost 10 years to figure this out as to how to do this. I'm working with probably one of the best IT groups in the world called About Objects. And their specialty is in mobile devices. When I say mobile device, I'm talking about a platform that's going to communicate to you information that's relevant to the patient right at the point of care. I talked to a surgeon from Sri Lanka, and he was doing surgery in the middle of the field just by himself using ketamine in his hands. So this young man proves to me you can take care of a patient no matter where they are. And so to me, the important thing is to get the right information into your hand so that you can actually do what you need to do, irrespective of whether you're in a hospital or not.
Absolutely. And it is a real problem, like as we see with Ukraine at the moment, because we've had displacement of over 4.3 million children, from UNICEF have reported. And perhaps the experience that you've just outlined there can be very helpful for our colleagues in the Ukraine. And as you mentioned, medical errors across the world. I mean, I know the statistics from the WHO are around 2 million deaths per year just from medical errors. So this digital tool that you're explaining here can be a huge resource and provide an opportunity to solve those problems.
Absolutely. I mean, the issue was I was involved by doing some research to try to figure out what happened in Afghanistan, because we wanted to know how many kids were really stepping on landmines. Well, we looked at over 5,000 kids that had been involved in some kind of a blast injury, and the blast injury is unique because your injury comes from the barotrauma. It comes from the wave. The pressure wave is what does it. That pressure wave lifts you up. It throws things around so that you can get hurt in a lot of different ways. And when you have the patient that has a blast injury like that, it affects the cell, and everything is affected. So what you need an algorithm or a protocol as to how to follow these kids through. One of the things we've done with the app is I hate to call it an app because it's really a system. It's a communication system. It's a platform. We have started to load onto that blast injuries. Now, I can tell you, we're just at the beginning. We've been working on this for the last 3 or 4 years, but the product itself, called Triaj 2.1.1, is now in the Apple Store that you can download right now while I'm talking. Why don't you do that? It's a good idea, because then you'll get a better idea of what we're talking about. But in that has all the information that you need to take care of a child right now. Okay? Now, it may not have exactly the diagnosis you want, but it covers most of the major problems that you have for kids that are injured. And we have some in there about kids that have appendicitis and things like that. So this is a good screen here. Thank you very much, Gareth, for putting this up. Could you bring it up a little bit?
Yep, no problem. I think we might only be able to, let me see if I can bring it in closer.
No, I want to give you guys a demonstration, but that'll take too long. And yet this is a good screen because it shows you a launch pad. If you look in the one over here where it says patients, you can add 30 patients on this. It gives you all the details of the patient that you're following. The decision support system allows you to follow through, click on the information, and what it does when you click on, say, placement of a chest tube, it actually teaches you or shows you how to take the next steps. That's the beauty of this. It's not a book. What it basically is a checklist that guides you to the right place. You would never get on an airplane if you didn't think the pilot was using a checklist to take off. You wouldn't. Well, that's exactly what we're doing here. We're trying to create the right information at the right time for the right person to make sure the patient gets the right care. And you can see here, if you look, there's medications that outline what the dosages are for the kids when they need it. It tells you, it adjusts by age and weight. So we think this app that about objects from a technical standpoint has helped us put together is a phenomenal tool. I didn't think it was going to be possible, to be honest with you, but we've got one of the slickest things I've ever seen. And it's only at the beginning. We have like 30 diagnoses on there right now, but each of those diagnoses is covered with everything that you'd want to know. It's almost like 1,200 resources on the app itself. So what we're trying to do is we're a young company. We've made no revenue. We are willing to give this out to the people in all over the world for free. And you can download that out of the Apple Store for free. It's triaj.com, and it's spelled with a J. We did that just to be cute, so that people could see it was different. And at the same time, you can start to use it right now. But as we go forward, I don't know if you want to show that to them.
Yeah, I was going to bring up the, this screen here, the explosive injury initial treatment plan, because I'm sure a lot of people viewing this would like to get an understanding of how practically they can use the app. And you might just talk us through, what are the benefits in terms of, early assessment, getting to the patient, that child who's suffering, this is a treatment plan that's available and readily available. And we want to try and get it out there as quickly as possible.
Yes, and the reality is it's for nurses also. Don't forget that. This is not about doctors. This is about the healthcare team. It's a team approach to caring for your child or for your family. And if you look very closely there, it says priority response, and then it says physiology, the physiologic arrangement. Then it says the anatomic arrangement, and then it shows you the nursing care. And it's put up so that you can just Yeah, just leave it right there for a second. Talks about the airway, what you should do to the patient, what kind of anatomy you have a problem with, and what types of nursing care the patient needs. So in one hand, and just, I can tell you, just in the one screen, there's more information on there that you have right in your hand than anybody does right now standing by a patient's bedside. So the point is, we're not trying to displace you. We're just trying to have you remember what you need to do in a simple way that can apply to the patient and save their life. Because right now, with the number of kids that are being exposed to munitions in Ukraine, it's just sad.
Absolutely. And I think that's the message that, through this broadcast, what we're trying to do is to get the message out there. So those who are watching it, please do share, please do like this video, share it with your colleagues, clinical colleagues, policymakers. This is a resource that is available. We want to get it out there so that it can be used. This is the key message here, isn't it, Dr. Eich?
Yeah. Can you just screen it up a little bit, scroll it up?
Mm-hmm.
So we're talking about hemorrhage control. Then we get into the breathing part of it. Go ahead, keep going. Just keep sliding on up. There's a whole area on circulation of how much blood, how much fluids to give the children. Before I forget this, the one thing you can do if you're out there, because we want to get this in the hands of the people in the streets of Ukraine or in Poland or any place if there's something that's going on. We want to get this into the field so that people can use it today. That's the most important thing. And probably the most critical device that you can use is a tourniquet. So if you carry a small tourniquet in your pocket, you can save a life. I guarantee all the military guys are carrying tourniquets. The other part of this is you can use your hands. You don't have to have everything. All you have to do is open the patient's airway, make sure that you stop the bleeding. So just put your hand on it. I'm telling you, it's not rocket science. This is simple. And then make sure that to stop the bleeding, you can also use, especially with these kids with amputations, they're going to lose their leg, wrap them up real fast and stop that bleeding, because that will keep all that blood volume inside their bodies and they'll survive. And try to keep them warm, keep them in a sheltered environment, and make sure that their airway stays open. That's all you need to do right now for emergency care. And then when somebody's in the field, this will help them, guide them as to what they need to do. Will they be able to do everything exactly correctly by this chat? No, they're not going to be able to, but this would be the best they can do until they get mobilized and carried someplace where there's a higher echelon of care. The problem is that doesn't exist in Ukraine right now. It takes a long time to do that. We had that in Afghanistan, and still people were having difficult times with the injuries that they sustained. Slide it up a little bit more. The thing about those resources is that is in the app. What I just showed you is in the app right now. And all you need to do is click it and you'll have the information on your hand. And the diagnoses that are in there, they talk about head injury, chest injuries, abdominal injuries, femur fracture. And at the same time, it talks about the physiology of how to take care of them, the critical care portions of this. So,
and just a quick question. You have a virtual pediatric trauma center as well. And how do people access that? I think I have the details here. I'll bring them up just so that people, can you just explain what that is? And just so that our audience can understand, because this is getting into technical side and, really valuable for nurses, clinicians, but also civil society. How can they access this information?
Yeah, I think right now the most important thing for all of us to do is to make sure that you have access to this information. We need to get it to you. And the Virtual Pediatric Trauma Center, we started this concept 10 years ago. And Jane Ball, myself, and Eric Elster, people who are experts in their areas, sat down and tried to figure this out. Dr. Elster was a surgeon that was over in Afghanistan. He's now the dean of the medical school of the military service. So he's a sharp guy. And so the key here is that we have to take good people like yourselves, feed back information to us to make it better. Because what's going to be the future of medicine is everything's going to be virtual. Everything's going to be digital. And doctors, older doctors like me, we're retiring. The younger generation's taken over. Digital approach to medical care is what it's all about. And so we've tried to take the information and put all that information in a place that you have access to, which is on our website that you have right underneath there. It tells you what the website is. And it's also got the password. We're doing this, by the way. We were asked to do this on Sunday last week.
I think you've touched on a very important point there, because people are probably not aware that we're short of 18 million staff by 2030. And they probably don't realize over the last year with COVID, for example, just in the US, we've lost 500,000 medical practitioners. So we're in a real predicament around medical education and the future of health. So what you're providing here is a tool, a digital tool that can support civil society and the wider community empower themselves, so when these traumatic situations arise, because I'm sure this application can be applied to, as we've seen in the demonstration video, through a car accident, so it's a really valuable resource to have this, not just for the Ukraine, Afghanistan, and you mentioned other countries that are in conflict.
We need it right here in the United States. So, this is a generic humanitarian issue that we're talking about. It's providing, basically, we've got mothers and kids running around all over the world without any shelter, without any food, without any health care. I mean, we have got to do something about that. And the only way we can do it is push the information closer to those individuals that need it. And so what we're trying to do is to build a long-term platform. And I can tell you, it's really disappointing to know that 500,000 just in the United States healthcare providers are giving up. And I understand why. One of the things this is going to do is going to cut out the amount of time they need to spend on the electronic medical record, because it's all digitized. The information gets stored in the cloud. Now we got 1,000 kids with a femur fracture instead of one. That makes sense, doesn't it? Because now we can put artificial intelligence up there and analyze that data. Now we got standardized information. Boom, we got the best way to take care of the problem, which right now we sort of try to figure out.
And I think quite a lot of people have, from an electric surgery point of view, in the UK has 6 million on a waiting list, globally about 28 million on an elective surgery list. So, these problems are growing for the health service. I just wanted to wrap up, because I think we've covered quite a lot and you've gone into major detail here. Just a couple final points for those watching the session here and those who will watch it on recorded. What would your final tips be for people who are out there in the field at the moment, if they come across, you've kind of explained, but some final notes from yourself, and what do people need to do in the next steps?
I guess the most important thing is that we need to put kids first.
Mm-hmm. Absolutely.
When you make them the focus, everything else falls into place. Right now, that's not happening. And so what we need to do is make sure that those kids we create some kind of a safe environment around them. And when the war in Afghanistan, the one thing we learned was, a lot of kids had blast injuries, but a lot of them got hit by a car. A lot of them had poisoning. A lot of them got burned because of the cultural differences. So our app covers all that information. We got a whole section on burns in there. That's something people don't think about. Well, it's common. So the point being is that blast injury is something that is very difficult to manage. We have to address that and then make sure we have the other components ready to go when you're going to need it. And from my standpoint, we've got to get this out into the field. We've got to be able to put this out there to get feedback from the individuals that are using it to make it better as we go. We're not claiming it's the best thing that can exist. It's good. It is really good. But at the same time, you have the opportunity to get on Safe Kids Worldwide's website. There's plenty of information there to how to take care of kids and keep them in a safe environment. So I would hope that you're going to join us in this journey. We've made tremendous strides in trying to solve this problem. This is not an easy problem when it comes down to managing contact and getting it to you. But it's also an educational tool. We can measure things with it. And it's available right now, so that we don't need to put any doctors and nurses or boots on the ground. People can actually use this on their own. So at first I thought it was just going to be useful for healthcare providers, but I can tell you there's a lot of mothers out there that can take care of these kids that are having problems using this kind of an assistance. And at least they're trying to do something. to keep their child alive.
Yeah, it's a fabulous tool.
We look forward to having you on our team. I'm available. We have a great team of people that are working on this, and the IT people we're working with is superb. You give us an idea, we'll break it down and put it into simple facts that we can feed back to you. The beauty of the app is we can change it overnight. We can make changes quickly. And so I think we're in a position, and Gareth has done a fantastic job of helping, guiding us to the point where we can actually get this information out to you. I'm willing to go any place and talk to anybody if it's about kids. So
I think, look, you're on a humanitarian mission and we're fully behind you. I mean, we only were introduced by a mutual friend the other day, and like we've moved on it quite quickly. I'm grateful to Al Berkeley for that introduction. And look, we're fully behind what you're trying to achieve. I think anyone who wants to get in touch, the details are there, www.triaj.com. You can email pr@triaj.com. This is a record. If you're watching this as a recording as well, please feel free to go online, download the app. And if you have any questions, do put them to us. We're available 24/7, and we'll certainly introduce you to Dr. Eike at any point. I think what we'll do is we'll close the session and just say to everyone, thanks for your support. Do get involved. Put children at the center. I think that's the message. That's the key point from this discussion. And I just want to thank Dr. Eike for your time and for the work that you're doing to support these children at this most vulnerable time. So we'll close this session and we'll just say goodbye to everyone. So thanks everyone for joining us, and we'll talk very soon.